I had been out of work for about 4 years and was very much lacking in confidence.
I've a husband and 5 children, and my times I have to be in the wards for 7:30 in the morning. I'm home in time for the kids getting out of school.
I had twins when I was 18. Now they're 18. They're out working, so I wanted to go back to work.
It's completely different compared to what I used to.
I was unemployed for over 10 years. I was a carer for my mother. I wouldn't have thought I had any chance of getting a job because I didn't have any qualifications. I left school without them.
The aim of the Employability Access Project is to improve access to real job opportunities for people living in North Belfast who are out of work or have been unemployed for a good length of time.
We work with 2 of the largest organisations within North Belfast, the Mater Hospital and the North and West Trust.
Before the EAP, the trusts were having major difficulty in recruiting motivated staff in entry-level posts within catering and domestic services.
All of them that we have taken on, they're very enthusiastic. They're very pleased that they've got employment. They see it as an achievement for themselves, and their enthusiasm rubs off on the staff that they work alongside. And the word of mouth within the communities. Because we're a community setting, the employment project has brought us more people through the natural process.
The project itself is in 2 distinct parts: 4 weeks of training and 2 weeks of job shadowing.
We're going to start this morning filling in what we call a participant profile. Nothing too complicated.
The first 4 weeks of the Employability Access Project are spent in a classroom type situation. It's done over 3 short days. During this time, we cover a number of issues. It's split into 2 different parts. The first is STEPS, which is Steps to Excellence for Personal Development. This course teaches confidence building, personal development and motivation. The second half of the day is spent working on employability issues and applying for the roles on offer. This includes assertiveness training, interview skills and filling in application forms. The final 2 weeks of the Employability Access Project are spent job shadowing with partner organisations.
The shadow programme is vital for the success of the programme. It creates a real experience for the individuals when they're here for the 2 weeks prior to the interview. It creates confidence within the participants so they can prepare for the interview. After the shadow placement, they are ready for the job, they hit the ground running.
To make it easier for our participants to attend the Employability Access Project, we provide transport from your home to the project, we provide lunch on a daily basis, and we provide, if needed, childcare costs.
I'm a catering assistant, which involves serving the breakfast to the patients on the wards, also involves serving the lunches and the supper on the wards. Apart from that, obviously behind the scenes there's many varied jobs in the kitchen. Well, the Employment Access Project I found was very useful because I had been out of work for about 4 years, and obviously with that 4 years out of work was very much lacking in confidence, very much lacking in the ability to talk to people, and also was very unsure of my ability to get back into work again after being out for so long. But whenever I went through the project, the communication part with other people, interacting with other people on the course, I thought it really brought me out of myself. And when I came in and did the job shadowing, the 2 weeks job shadowing in the hospital, it gave me a great opportunity to see exactly what work was involved, and to build the confidence and to realise that I could do the job. Obviously it's helped me financially because I'm much better off now than what I was out of work, on benefits. Obviously with experience in the hospital, if I should decide later on to move on to some other field, I think this is a good stepping stone towards that.
It's a completely different role compared to what I'm used to. I'm used to waitressing, so I am, rather than working in just a set environment. I'm more confident myself, because with being unemployed, confidence had went down, and I've just got more confident in myself. With the regular money coming in, and I've able to get myself together a wee bit more. The course that I did gave me a lot of self-confidence and getting into the hospital, and give me more respect as well for myself.
I'm working for the Mater in the support service team. I'm a domestic. We meet people every single day, so we do, mostly patients. And when you see a wee smile in their faces, then you know you're done well. I was unemployed, and I was just getting to the stage where I didn't want to be it anymore. I wanted to go out and do something. And the leaflet happened to come through the door. I've a husband and 5 children. I have to be in the wards for 7:30 in the morning. So my husband, I get the support in the house. He gets the kids and all out to school and all, so I have no need to worry. So, and I'm home in time for the kids getting out of school. I was very shy and all, but it's gradually opening up where I'm meeting new people and I'm actually talking more than being stuck in the house.
I was unemployed for over 10 years. I was a carer for my mother, so I couldn't work, And then after my mother died, I went on the scheme, so I did. You came here for 2 weeks. You work shadowed, so you did, and then you got an interview. And I loved it. I loved even the work shadow when I came here. I had never been on an interview in my life, and I went on that course, and they give us all different techniques for interviews, and they done mock interviews with us. Told us, they didn't tell you how to act or react. They just told you certain things, like sort of to try and look people in the face and tell them the truth. Don't over embellish things. Just tell them the truth, that you want the job, you want to work, you'll be happy to work. So it was, and I'd never filled an interview form in my life. I wouldn't have thought I had any chance of getting a job because I didn't have any qualifications. I left school without them, and I was told it doesn't matter about the qualifications. If you want to work, employers think you want to work, they'll employ you. Then it's up to yourself. I'm looking forward to Christmas for the first time in a long time. Instead of having to think about sort of, am I going to have enough to buy all my nephews and whoever I'm buying? I know I've got it covered, Plus the prayer didn't work. You walk in anywhere unless you got your uniform on. People know you work in the hospital, and you don't work down here unless you enjoy it.
Haven't worked in 18 years, and it's just a completely different way of life to me. I had twins when I was 18 and a half, brought them up Rardon. Now they're 18, they're out working, so I wanted to go back to work. I've always wanted to come out to work, but I didn't want to leave my children with strangers, and I didn't want to leave them with family either. It was my duty to rear them, now they're reared. I just wanted back to work. That's why I went on the EAP course, to try and get a job. It just changed my life completely, everything. First of all, the job. When I got the job, it was just, even the course itself. The first day I went on the course, I says to one of the tutors, can you pull out of here at any time? And she said, yeah, you can. First day I went there, it was just fantastic. Because I was very shy, Once I got on the course, I met everybody. It was just like a new family, We all just mucked in there, and this is where it got me the day. The first day coming out to work, it was a bit scary because I hadn't been to work, in years. But once I got the first day over, met everybody here, it was great. Before I would have been very shy, Now I'm outgoing. I would talk more to people, would get involved in more things and stuff. One of the supervisors was on there the day, and I'm going to do a health and safety course on Thursday. So there's different options, open to you all the time. Every fortnight I was on Job Seekers, and it was a nightmare seeking down to sign on for 50 quid a week. It was just a nightmare. Now for full wage every week, I would advise anybody that's on Job Seekers to get out there, get on that course and get their head down and get on it, start it. I bounce up in the morning. I love getting up in the morning to come out to work. And then on a Thursday when you get your pay, you can buy yourself something every week, where for years you couldn't. I just love getting up in the mornings to come in here, honestly. Life has changed big time, for the better. Definitely for the better.
The project is reviewing and, where appropriate, amending any restrictive recruitment and selection practices that the Mater and the North and West Trust have at the moment. The idea of this is to make it easier and more accessible and less complicated for people looking for entry-level jobs in the health sector.
It has helped us identify the problems that we weren't aware of, that were actually preventing people getting into the workplace. such as our application forms, our processes and the procedures that were so long-winded that stopped people and were a barrier.
The last participants from the EAP were very well prepared for the jobs that we were expecting these people to do. They were motivated, they were prepared for the job, they had an extensive induction and they really enjoyed working with the patients.
It has solved quite a few of our problems. We have half the recruitment problems in North Belfast. This time last year when we spoke, we were sitting with 22 vacancies. We now have about 8 vacancies in North Belfast altogether.
Qualifications don't come into it. When people are successful within the Mater Hospital and support services, we train staff up. It's social skills we're looking for. It's people to be honest and loyal to the hospital we're looking for. And we look at our staff as key resources within the hospital. We work together as a team. Cleaning and catering is very, very much important for the patient's care within the hospital.
The Employability Access Project for participants has been running since January 2006. And during that time, over half the people who have been on the course are in jobs or have been offered positions and are waiting to begin. We are running 10 programmes all in all, and we are delivering programmes until June 2007.
In our line of work, there are a lot of these projects, a lot of government initiatives. This one really has stayed the time, and it has brought the quantitative as well as the qualitative purchase at the end of it. Yep, it did, as they say in Ronseal, it did exactly what it said on the tin.
The Employability Access Project Development Partnership is funded by the European Social Fund under the Northern Ireland Equal Community Initiative programme and the Department for Employment and Learning.